for the introduction. My name is Alexandra Guevarez, and so I will be presenting today a study published in the American Journal of Ophthalmology in January. It was titled Outer Retina Thinning Associated with Brain Atrophy in Early Age-Related Macular Degeneration. So a quick introduction. So both retinal changes and age-related macular degeneration have been associated with Alzheimer's disease and other dementias. But in age-related macular degeneration, outer retinal changes are early and significant, but not much is known about these changes in association with cognition or brain morphometry. But just a quick review on age-related macular degeneration. It's pretty much a painless central or pericentral visual impairment with reduced visual acuity, difficulty adapting to changes in lighting. The dry version of AMD is more prevalent. It's a slow progressive visual impairment, usually over decades, and unilateral or bilateral onset. And wet AMD is acute or insidious onset over weeks to months and usually manifests in one eye first. And the clinical features are usually metamorphopsia, which is a type of visual distortion where if you're looking at straight lines, they would appear wavy, and that can be tested with the Amsler grid. And they usually also have a blind spot or a scotoma. So in this study, this was a cross-sectional study with participants from the University of Alabama and the University of Washington. The patients were 70 years or older, with or without diagnosis of early or intermediate AMD. If they had a known history of Alzheimer's disease, frontotemporal dementia, or another dementia, they were excluded from the study. Some were recruited with normal retinal aging. 2 recruits were diagnosed with advanced AMD and they were excluded from the study, and 7 were excluded for missing MRI measures, and that led us to a total of 60 participants. So in measuring the cognitive parameters, they used a NIH toolbox for assessment of neurological and behavioral function. So these gave 2 composite scores, one with fluid cognitive abilities, which would be the ability to learn new information and solve problems, and the other was crystallized cognitive abilities with vocabulary, knowledge, and reasoning based on acquired information. And so the OCT acquisition and analysis, they used a grading grid called the Early Treatment of Diabetic Retinopathy Study Grading Grid, ETDRS for an acronym. So it has 9 subfields. So it has an outer ring, an inner ring, and the central subfield, and then these are all divided. And it also showed the vertical organization of the retinal neurons. And so the inner retina here represented by nerve fiber layer, ganglion cell layer, and inner plexiform layer and inner nuclear layer. And then outer retina here with the outer plexiform layer all the way out to the retinal pigmented epithelium and Brooks membrane. And so then total retina was just classified with inner and outer retina. And so for brain imaging and acquisition, they did MRI measurements. They looked at the volume of the total brain, cerebral white matter, gray matter, and hippocampus volume. They looked at specifically occipital cortex regions of interest and their thickness. There were 2 areas called early visual processing, which was the pericalcarine regions, including V1, and the mid-level visual processing, which had the cuneus, lateral occipital, and lingual lobes. And then they had cortical thickness and ADRD-related brain regions. That was Alzheimer's disease-related, dementia-related brain regions. And these were areas that were shown to indicate early structural and functional changes in dementia. And so this was the entorhinal, superior parietal, inferior parietal cortex of pars apicularis, pars orbitalis, pars triangularis, posterior cingulate, precuneus, and temporal pole. So the statistical analysis that they did an analysis of variance with the gender and MRI measurements. They did a Pearson correlation coefficient with age, years of education, cognitive test scores, and MRI measurements. They did a linear regression with the association between retinal thickness and ADRD brain-related regions. They did a separate multivariable regression for each brain variable and each retinal layer thickness variable adjusted for age, years of education, and cognitive test scores. And then they also did a lasso regression, and this identified the most relevant ET-DRS subfields and retinal thickness measurements in association with each MRI measure. And for each of those statistical analyses, the p-value of less than 0.05 was considered significant. So in the results, education had a positive correlation with total gray matter volume. There was no significant correlation of the retinal thickness, brain volumetric measurements, or cortical thickness with the cognitive test scores. And this were just some figures highlighting the population in terms of education, sex, age, and the averages for their cognition parameters, the averages for their brain parameters, and the averages for their retina parameters. And so people with a thinner total retina were associated with thinner occipital regions of interest and a thinner cortex in the AD-RD related regions. And people with a thinner outer retina were associated with smaller hippocampus, thinner occipital ROIs, and a thinner cortex in AD-RD related regions. And so with the lasso modeling, all retinal thickness variables had a 0 coefficient value for occipital ROI's thickness, white matter volume, and total brain volume. But thinner outer retinal thickness in the outer ring was the most frequently reported variable that predicted lower brain measurements in terms of volume and cortical thickness. So it's consistently showed a non-zero coefficient across the cortex, gray matter, hippocampal volume, and the cortex thickness in the AD-RD related regions. So there was another similar study done. It was similar to this one, but it focused on the inner retina changes and brain atrophy and visual pathways, but it excluded patients with age-related macular degeneration. And so the lasso analysis showed changes in the outer retinal thickness was the most influential on cortical thickness in AD-RD related regions. And that thinner outer retinal thickness was associated with atrophy in brain regions involved in vision, memory, and again, the Alzheimer's disease related regions. So the thinning occipital regions of interest, lower hippocampal volume, and areas known to show early structural and functional changes in early dementia. So this was a small sample size of 60 participants, but there were some significant correlations. The study was not meant to assess a causal relationship, but just to explore the relationships between retinal changes and brain health in a population with early or intermediate age-related macular degeneration at risk of developing Alzheimer's disease. So any generalizability or hypotheses of the causal mechanisms should be interpreted with caution, but future research with a larger sample size and replication studies would be important to confirm these associations. Oh, any questions?